Good afternoon.
Hello, everyone.
Good afternoon, and welcome to 3 o'clock with SOC. Give me a second while I welcome our Spanish-speaking guests. Buenas tardes. Gracias por estar con nosotros hoy a las 3 p.m. con SOC. Para acceso al programa en español, por favor, marque el número que aparece en la pantalla, que es 425-436-6200. Cuando contesta la llamada, por favor, comparte la contraseña, que es 627682. Gracias. Hi, everyone. My name is Taylor, and I am the Youth Coordinator with Southside Organizing Center. I'm here with Gabe Charles, who's our Civic and Census Engagement Manager. Although we are still digital, we wanted to thank you for joining our 3 o'clock with SOC, our community forum. Although we are digital, we still want you to know that we are here for you, and you can reach us at any time by continuing to reach us on our phone number, which is 414-672-8090, where we have Gladia on the line answering all of your calls. You can also email us at soc@socmilwaukee.org or visit our webpage at socmilwaukee.org, where we have a full page dedicated to resources in response to the coronavirus. Shout out to our forum team that is working behind the scenes right now to put this forum on for you all. Before we do start our program, we want to remind you of a couple things. We are doing a gift card giveaway to a local business. You can enter to win by completing the survey, which is listed. It will also be available in the comments. You're able to select a restaurant from a list of local businesses that are supporting SOC. And it's very, very simple. It may take you 2 to 3 minutes tops, but you can fill this survey out every day after our forum. Let us know what we're doing. Let us know what questions you have. We want to hear from you. We want to know what it is that our community needs so we can be able to provide those resources for you and hear your voice. So again, this is a reminder that you can fill out that survey after our community forum today. We also wanted to let you know our upcoming guests that we have for this week. We have some great guests. So tomorrow, which is Wednesday, we have Chevy Johnson, the president of the Common Council, that will be joining us. And on Thursday, we have Mandela Barnes, the newly elected lieutenant governor. And on Friday, we have Dr. Keith Plosley, the MPS superintendent. So we have some great guests for you coming up this week. Also wanted to share a disclaimer with you that the views and opinions shared today do not necessarily reflect those of SOC. We do have a lot of discussions, and we want your opinion and voice to be heard, but wanted to let you know that the views and opinions don't necessarily reflect those at SOC. With that being said, we would like to invite our very special guest with us today, an admired colleague on our community forums, Moranda Medina-Lopez.
Hey, ladies. Hey, Miranda.
Thank you so much for joining us on our community forum. For those that don't know, Miranda actually works backstage with us during our community forums as our Spanish translator. But today we're so excited to have you joining us on our community forum as a guest. Miranda is a health educator with the Wisconsin Women's Health Foundation. So we're really glad to have you and excited to hear about what it is that you do and how your organization has been impacted during the coronavirus.
Thank you guys for having me.
Yeah, absolutely. If you want to take a couple of minutes to talk about what is your role at the Wisconsin Women's Health Foundation.
Yeah, so this is my second time around with the Wisconsin Women's Health Foundation. I worked for them about 5 years ago, and now I'm back as a bilingual maternal health educator, also known as a QUIP coach. So I work with one of their statewide programs. I get to work with women that are pregnant or have just had a baby, and help them meet their goals, specifically pertaining to staying smoke-free or quitting smoking. But I get to work with them in a lot of other ways too, setting different goals and things like that. So Wisconsin Women's Health Foundation is kind of like a hidden gem. They have a lot of amazing resources. So I just wanted to make sure that more people knew about the resources, especially right now during COVID-19, when knowing resources is super important.
Impacted your organization with you being able to provide those resources?
You cut off a little bit at the beginning. What was that, Taylor?
Sorry about that. Can you give us a sense of how the coronavirus has impacted how you guys are giving out those resources?
Absolutely. So there's two programs that I wanted to mention that I feel like have been really helpful and really important. The first is called the Wisconsin Well Badger Resource Center. There you go. It's an online directory. That's one of the options that we have, but we have over 3,000 different services and programs divided by 6 different main topic areas. And all of the services in the directory have to meet very strict criteria. So all the information is verified. We have a specialist that calls, make sure that they really are offering the services that they say that they're offering, and that they get back to people in a timely manner, that they're treating people with respect, things like that. So the Wisconsin Well Badger Resource Center you can call them, you can text them, you can email them, you can chat with them on Messenger, you can chat with them on our website too. They're available Monday through Friday, 7 a.m. to 6 p.m. We do have interpreter services available, which I'm really proud to say. But during coronavirus, we've really had to amp up because all of the calls and the texts that we're getting about everyday things like, where's my unemployment check? How do I get formula if WIC is closed? My baby needs her vaccines. Do I still need to get them? So we have our certified specialists available, answering phones, answering emails, we had to make we chose to make a specific COVID-19 resource page just so that, just like you guys do, all of the information is one spot, and we can update it really quickly. Wellbadger.org is our website. And so there's different ways that people can use Well Badger. They can call or text or chat or email a specialist, but also maybe they have a good idea and they just need somebody's phone number. So they already know kind of the resource that they're looking for. They can scroll through our list of local programs and services and find out what they need from there. So we've definitely had a huge uptick since Corona has started affecting families. We get all kinds of questions, and if we can't answer the question, we will definitely get back to you. I say I'm not one of the specialists. I get to deal with the women in First Breath, but the specialists are amazing. They answer calls from all over the state. So it's a really great program. And if you have any questions, it's great because it doesn't have that super, super high volume. 211 is a great resource. Looking at your city's website, those are amazing resources as well. But this offers a little more personal attention because you get that one-on-one person. You can sign up for email updates and they'll follow up with you too.
Well, I'm so glad that we're having you on our community forum today. And I wish we kind of had you a little bit earlier because it's such a great resource to women out there. A lot of times, I'll speak for myself, we don't know where we can go, and having to dig through Google or having to see what resources are out there that we can trust. And I'm glad that you guys, have over 3,000 services that are verified and proven that are helpful. So like Miranda mentioned, you guys can call, text, or visit online by going to wellbadger.org, and they have that there for you. Miranda, what would you say would be maybe like one of the number one questions that women are calling during this time? What is it that people are looking for right now? Between
Well Badger and then the program that I work with, First Breath, I would say that information about rent assistance and unemployment have been the biggest. I have to stay home. How am I going to pay my rent? Do I have to pay my rent? What about my mortgage? Do I have to pay my mortgage? And then, stimulus and unemployment. How do I don't have a computer at home. How do I do this? I've been on hold for so long. How do I make sure that I have everything turned in? So the specialists are up to date on the changes every week. I'm in a meeting where I get updated, but daily. They're making sure that they're updated on everything to give everybody that calls the correct information, and they'll walk you through it. If you don't have a printer, we'll mail it to you. Lots of really great resources. The women that I work with, the biggest, I would have to say, is between things like formula and diapers and living situations as well. So, like I said, my landlord is really getting on me and I can't pay my rent. What do I do? We also educate them about their rights as well and let them know, no, you can let your landlord know that he can't evict you right now, that you're going to pay your rent, but you're waiting for your unemployment check. So educating, advocating, it's not just giving them information.
I just want to take a chance to see who's saying hi and to see if any of our viewers have questions for you about these really amazing programs you've been mentioning that I can tell are impacting a lot of people and helping people get access to the information that really will make a difference during this time. So we have Denise. Hi, Denise. We have Paula. She says she's very proud of her daughter. I assume that's your mother. Cute. I'll pop that one up there for you. Very adorable. Then we have Marianne also. Does anyone have any questions for Miranda regarding any of the information she shared? You were extremely thorough, so I would not be surprised if there aren't any. And then I just want to ask you if we shared all the images that you had prepared for us, just to make sure.
Yeah, so they kind of popped up.
Okay.
Yeah.
There's all of them.
There's one that I haven't seen yet that shows some of the other quick coaches or maternal educators like what I am. We have a really diverse team. Those are some of our participants right there, our previous and current first breath participants and their babies. And then there was another one that just more about our first breath program and, education for all household members. Obviously, we're not doing our home visits right now, which is really sad because I really miss all my participants. I miss getting out, doing one-on-one chatting with them. We do screen for things like postpartum depression, domestic violence, safe sleep for baby. And it's hard to do that when you're not in their home. Our program for First Breath, you go to where the participants are. So if they're, just had a baby and they're at home, that's where we meet them. If they've got other kids and they want to meet at the park, that's where we meet them. And right now, I'm really grateful that we're still able to do our visits, but they're all being done virtually. So lots of, there we are. There's the whole team of the First Breath Quick Coaches. So we're all over the state. I'm obviously here in Milwaukee, but we cover the entire state. So, and we're a really diverse group. Some of us are lactation specialists. Some of us have social work background. Some of us have more of a community grassroots background. So if anybody is, looking for a place for resources, especially, for you and your family in coronavirus time, and or you're trying to make some, decisions to make your pregnancy be healthier, you have a new baby and you want to quit smoking, those are definitely things we can help with. There's our First Breath Facebook page, no judgment, just support is our motto. We will work with you kind of whatever your goals are. Maybe you're just trying to cut down, maybe you're trying to have a smoke-free home, maybe you're trying to avoid a SID situation because you had that happen before. We're happy to help kind of in whatever capacity we can.
Awesome. I'm glad we got to show those images of the people that are doing this work, and excited to see that you're able to adapt to the times, even though you can't meet people where they're at, still finding a way to serve them is so important.
It really,
we all know and are trying to ourselves, right?
Yeah, and it helps me too. I mean, I still get to see these women on FaceTime and Messenger and connect with them, especially when we were, it was so cold we couldn't go out. And it was great for me to be able to see their faces and, hear updates and, kind of exchange stories about our struggles and all the struggles that we all have right now. So I'm super grateful that the program is actually, flourishing and growing. We have providers all over the state that refer people to us, but women can also refer themselves too. So we'll share the information, WWHF.org, and you can find information about Well Badger, First Breath. You can refer yourself. You can chat with a specialist. There's all kinds of good stuff. Like I said, WWHF is kind of like a hidden gem.
Awesome. How about we have some viewers drop some hearts or some likes in our comment section, letting Miranda know that you're thankful for the information that she shared. Write down something that you learned from what she wrote or what she spoke about, and let us know that you appreciate this information from our community leaders.
Yeah, we're working, WWHF and SOC are working together with Tammy to be able to include this information on your resource page as well. So I know that everything's recorded, but hopefully we'll have everything on your resource page as well too.
Definitely.
Yeah, that would be. Can we toss up the graphic for the website and the phone number so that people can be able to reach out to the Wisconsin Health Foundation whenever they want? Again, as a reminder, you can call or even text if you don't feel comfortable. Monday through Friday from 7 a.m. to 6 p.m. They are available for you. They have a variety of resources. So just make sure that you write down this phone number, because I know I'm going to write this down and share it with you.
So helpful. Yeah.
It is really helpful, and I'm glad to have an organization that provides resources specifically to women.
Absolutely. And the great thing about the texting option is, let's say it's 8 o'clock at night and you think of, oh my gosh, I need to find a birth to 3 program for my son. You can text them. Obviously, they're not going to answer you at 8 o'clock at night, but then you already the ball started rolling. So the ball's in their court and they'll get back to you the next day. So it's really easy to reach out for help. It makes it really convenient because we're all so busy.
Yeah, that is very convenient. Well, thank you so much, Miranda. Is there anything else that you wanted to add?
I don't think so. I mean, if you're an individual, a mom, a sister, I encourage you to take down the information, even if it's not pertinent to you. Maybe you don't have kids. You never know when you're going to have a question. I personally have a Post-it on my fridge with the Well Badger number because there's always things that can pop up. So, just jot down the information and pass it along to a friend or a family member, and keep encouraging all the moms in your life that are, maybe struggling a little bit right now, and let them know that there are options out there.
Definitely. Just want to take a second to share the love that you got from the Women's Health Foundation. Thanks for representing WWHF so well, Miranda. We're excited to have the opportunity to share information with the SOC community. We are also so excited. And then we have Erika saying, thank you. This will be a good resource for our clients at Core Centro.
Yeah.
So
go
ahead.
I have a lot. So I just started again with WWHF in January. So I had planned for this spring and summer to do all kinds of outreach to organizations on the South Side. You really use this as an opportunity to open up First Breath and Well Badger to the South Side of Milwaukee. I am obviously bilingual, so I'm the only bilingual quit coach, so we can offer that service as well. But with COVID, it's kind of put a damper on it. So I really appreciate the opportunity, because I know so many organizations look to SOC for information. So my information is on the website. Chrissy Alanis, she's the program manager. And between the two of us, we would be happy to, send you some info, some postcards, so you can, when everybody opens back up, you can share it with your clients.
That would be amazing. Thank you so much, Miranda.
You're welcome.
Thanks for being with us.
Bye. I'll see you later.
Thank you.
So Taylor, you have worked with SOC now in a few different capacities. Your title now says youth coordinator, but you were also the coronavirus coordinator. And so we're excited to be able to bring to all of you today our new coronavirus coordinator, Marlene Zaran. She has joined our team and makes another beautiful face for the SOC family. So we're going to bring her on to give us, hi, Marlene.
Hi.
So we're going to let Marlene take it away with the coronavirus update for today.
Hi, thank you for that introduction. So So today marks the end of the eviction moratorium, which means if someone or someone you know has not paid rent since the Safer at Home order has been in effect, there's a chance you can get evicted. Landlords now have the ability to file for evictions. That being said, we will talk about unemployment benefits and steps to take during this time. So according to the Wisconsin Department of Workforce Development, you have the ability to apply for unemployment right now. So some of the requirements is that if you are an employee with reduced hours or wages, you've been granted leave of absence and will be returning to your job, you have been laid off permanently with no intention of returning to your job, you're unable to go to work because the place of employment is closed because of an executive order or other shelter-in-place order. If you fall under any of the requirements I just mentioned, then you're eligible for regular unemployment benefits for 26 weeks. And under the CARES Act, you're eligible for $600 a week on top of the regular unemployment benefits. And that is also up to 13 additional weeks of expanded unemployment benefits. So to be eligible for the CARES Act, you have to fall under these requirements. You're self-employed, an independent contractor, you are a 1099 worker, you've been diagnosed with COVID-19, you have a member of your household who has been diagnosed with COVID-19, you are unable to reach the place of employment that you work on because of coronavirus, you've been you're a primary caregiver responsible for a child or other person who is unable to attend school, you're unable to reach the place of employment because of an executive order or other shelter-in-place order, you were scheduled to start work but you don't have a job because of COVID, you've become the major support for a household because the head of your household has passed away due to COVID, or you have quit your job as a direct result of COVID. If you fall under any of those requirements, you have eligibility for unemployment benefits up to 39 weeks of expanded benefits, and you might also be eligible for $300 extra a week on top of that. So now that we've talked about that, I'd like to give some information for tenants. So anyone living in an apartment or home, definitely communicate your health and income changes to your landlord such as a loss of income. Reach out to resources within your community. There's definitely temporary rental assistance available to you based on your situation. Now, if you are a landlord, your tenants may be going through a hard time during the COVID-19 public health emergency. So it's important to stay in contact with them to prevent problems from developing. A great resource I recommend is community advocates, which can help connect you to temporary rental or energy assistance, legal services, landlord and tenant mediation, and other basic services. So you can call them at the rent helpline at 414-270-4646. And there's also an email you can contact and link that we'll post in the comments. In other news related to COVID-19 testing, the testing site at the Midtown Center will be on hold and paused from further testing for right now. So an alternate testing location would be at Advocate Aurora Health Midtown Clinic, which is located at 5818 West Capitol Drive. It's available to anyone regardless of your ability to pay. And if you're experiencing at least one COVID-19 symptom, you can go in. But you have to make sure that you set up an appointment with them and that you have at least one COVID-19 symptom, which includes a cough, shortness of breath, and fever, and along with other symptoms. In order to make an appointment, you can use the Live Well app, or you can go to My Advocate Aurora website. You can also call phone number 877-819-5034, and the time and location and phone number will be also listed in the comments section. Thank you.
Thank you for that important information, Marlene. And just to be clear, the free testing center on the south side, UMOS, is still operating normally, right?
Yes, yes.
Okay, good to know, good to know. If you don't know this, that's fine, but do you know why they closed the one at Midtown? Did they explain from the information that you read?
No, based on the article, I didn't see any.
Yeah, interesting. Well, I'm glad that there are other options for folks on the north side, and glad to know that the one at UMOS is still operating. So thank you so much for that information, Marlene.
For sure.
So, like I said, that's our new coronavirus coordinator, Marlene. She's been a great addition to the team, and we're very happy to have her. So I will just go ahead and go into the civic update for today. In previous forums, I've talked about how the city has been going through a fiscal crisis because of the COVID-19 pandemic. And similarly, the county is facing very similar struggles financially based on the pandemic. And we found out from an article and a statement from David Crowley and the county board chairwoman, Marcelia Nicholson, that the state has absorbed over $100 million that was originally designated for Milwaukee County. And like I said, County Executive David Crowley and County Board Chairwoman Marcelia Nicholson put out a joint statement urging Governor Evers to return $103 million that was supposed to aid Milwaukee County in responding to COVID-19, but due to technicalities is now being used at the state level instead of the county level. And with Milwaukee County being the location of nearly half the state's total COVID-19 cases and over half of the total deaths, our county would definitely greatly benefit from these additional funds to fight COVID-19. And they would be especially useful to address the vast racial disparities that exist related to COVID-19 cases and deaths. Much of the money that's already being spent at the county level has been for purchasing personal protective equipment, hazard pay, cleaning and disinfecting supplies, and just generally reconfiguring county operations. And I'll read a little bit directly from the statement by Crowley and Nicholson that explains further how much Milwaukee needs these funds. Milwaukee County, to be specific. Wisconsin residents in Milwaukee County, particularly residents of color, are being hit hardest by this crisis. Now more than ever, they need the critical services that the county provides on behalf of the state, services that cost more money than the county has. Without adequate and direct funding, Milwaukee County will not be able to meet the increasing needs of our residents resulting from COVID-19. And our ability to provide critical services to our community's most vulnerable residents, including mental health care, housing resources, disability services, and services for our senior citizens, will be significantly impacted. So maybe Lieutenant Governor will be able to give us some information about that on Thursday when he joins us. If not, we will definitely keep following this and let folks know as we know updates about this money and whether any of it will get returned to Milwaukee County. With that, I want to share, as usual, a census video for everyone. This one is going to just talk again about the importance of doing the census, different ways you can do it, and the importance that it holds for your local community and your state as a whole.
It's important to stay healthy. So you know what's something that you can do at home that doesn't require you to be around a lot of people? You can take the census. And it doesn't matter if you're into politics or not. It doesn't matter what language you speak. No importa si no tiene papeles. If you live in the United States, you need to take the census.
Okay, but like, what is it? What is the census?
Here's how it works. Every 10 years, the government counts every single person living in the United States. This includes citizens, non-citizens, babies, abuelitas, literally everyone. If you haven't already, you will receive a notification in the mail from the U.S. Census Bureau, at which time you can fill out the census online. Even if you haven't gotten a notification, you can still fill out the census over the internet. Don't have internet? No problem. You can fill out the census by mail and over the phone. The best part of it is you don't have to leave your home.
What kind of questions do they ask?
The census asks basic questions like name, sex, age, race, or ethnicity, how many people live in your home, how they're related to one another, whether you rent or own, and that's pretty much it. Now, we get it. Nobody likes doing paperwork. Paperwork sucks. But you gotta remember, this paperwork takes 10 minutes to complete and will decide what happens to our neighborhoods for the next 10 years.
So why is it important for me to be counted?
Here are 2 reasons. It's important because it affects our political power. The House of Representatives has 435 seats. Because these seats are divided up by population, the census determines the number of seats your state gets in the House. After every census, adjustments are made. After the 2010 census, states like Texas gained 4 seats in the House, while states like New York and Ohio lost 2. The census not only affects the House of Representatives, but it reshapes the Electoral College. You know, the system that decides presidential elections. Census data is also used to redraw state and local legislative districts to better reflect shifting populations. So, you don't want to lose seats in the House of Representatives, and you don't want to lose your political power just because you decided to sit this one out. The census determines how public services in our communities get funded. The government uses the census to decide how much money should go to state and local governments. That money is then used to fund public services like schools, hospitals, roads, senior centers, and other public utilities. It's really hard for the government to plan where they should put schools and hospitals if they don't know how many people live in that neighborhood. Well, there have been instances where states do not get the funding for these vital services because they fail to meet the population requirement for certain federal funds. Take Circle Pines, Minnesota, for example. They were 82 people shy of the 5,000 population requirement to qualify for certain federal road funds. 82 people. The point is, if you don't make yourself counted, you're potentially losing money for your community, and that pothole down the street will never get fixed. The census will affect our political power. It will affect our elections. It will affect our daily lives for the next 10 years. That's the power of the census. And if we don't participate, we're putting our communities at risk.
So what you're saying is I can fill out the census, contribute to my community's political representation, financial future, and important demographic data for the next decade without ever having to leave my house?
Exactamente. So remember, wash your hands for 20 seconds, stay at home if you can, and make yourself counted in 2020. Because this is about the future of our families, our communities, and our country for the next 10 years.
Great video as usual with lots of important information. I just want to call attention to a comment that I saw by Diana that asks if there's going to be more information about the Safer at Home order in Milwaukee. We are going to hear from some great folks in the next few days. Chevy Johnson, president of the Common Council, will be on tomorrow. And then Thursday, Lieutenant Governor Mandela Barnes will be with us. And Friday, the MPS superintendent. So we will have lots of important information regarding Safer at Home and other local updates. So stay tuned over the next couple of days. We're going to invite our communications manager on now to talk about the SOC promo, as we've talked about on all our forums. So here we go with that.
Hi, Community Forum. Reminding you of our daily $25 gift certificate drawing by filling out the survey located in the comments section. In the following day's forum, we'll announce the winner. It's a quick 5-question survey, and you can enter daily and win daily. Thanks for those of you who have been filling them out, and thanks for tuning in. Now let's find out who's today's winner.
So today's winner is Eloina Zarate. Congratulations, Eloina. We are so happy and excited for you. Please get in touch with us at stock@stockmilwaukee.org. Message us on Facebook, however you can get in touch with us to make sure you get your gift certificates for $25. And with that is our forum, everybody. Thank you for joining us. Thank you for commenting and showing us love in the comment section. As a reminder, we have our special guests for the week. Chevy Johnson, the president of the Common Council, will be with us tomorrow. Then special guest on Thursday is Lieutenant Governor Mandela Barnes. And on Friday, we will have Dr. Keith Hosley, who is the MPS superintendent. So we've got a stacked week for all of you. It's going to be full of important information. So make sure you stay with us throughout this week to get all of the latest info from these amazing leaders, both locally and statewide. And with that, I'm going to leave you with a video that thanks our funders and give everyone a big virtual hug and welcome you all back to our forum tomorrow.
Hello, SOC viewers. My name is Isaiah, and I'm a youth organizer for SOC. We would like to thank everyone for supporting our 3 o'clock with SOC live show and for completing our SOC surveys. In addition to thanking our residents for tuning in and sharing our show, we would like to thank the following sponsors: Wisconsin Voices, Community Development Block Grants, NEO Philanthropy State Infrastructure Fund, Movement Voter Project, Catholic Campaign of Human Development, the Zilber Foundation, City of Milwaukee Office of Violence Prevention, Tide Foundation, City of Milwaukee Promise Zones, and all the faithful individuals who support SOC through their personal donations. Thank you.